Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. World Health Organization launches COVID-19 Law Lab initiative to gather and share legal documents from over 190 countries across the world. Nigeria Governors Forum agree on national post-COVID-19 blueprint to strengthen the risk communication and stronger collaboration with federal and state agencies. And according to the United Nations, a temporary basic income for the world's poorest people could slow the current surge in COVID-19 cases. Begin with the Nigeria Center for Disease Control, NCDC, confirming 543 new cases of COVID-19 and 8 deaths yesterday, putting the total confirmed cases at 38,344 cases. While 15,815 cases have been discharged, the death toll stands at 813. Of the 543 new cases, they're reported from 15 states: Lagos with 180, the FCT 86, Kaduna 56, Edo 47, Ondo 37, 35 in Kwara State, 19 in Ogun, another 19 in Rivers, while 17 in Kano, Ebonyi recording 16 more, also in Enugu 16 as well, Delta 7, 4 in Bayelsa, 3 in Bauchi, and 1 in Abia State. In the meantime, across the country, 138 persons have recovered from different isolation centers. The active cases in Nigeria stands at 21,716. The total samples tested in the country is now over 250,000. The NCDC puts the figure at 251,893. Now, members of the Nigeria Governors Forum, they've held a virtual meeting deliberating on issues affecting the country, especially the impact of the COVID-19 pandemic. At the end of the 13th teleconference meeting of the forum yesterday, state governors declared a state of emergency on sexual and gender-based violence and the willingness of members to engage in the development of a national post-COVID-19 blueprint. They also agreed to strengthen risk communication pillar of the state COVID-19 task teams as proposed by the Presidential Task Force on COVID-19, and also foster collaboration with the National Orientation Agency and the states as well, religious traditional institutions, to help step up the current efforts by taking health and safety measures to the doorsteps of all the 774 local government areas of the country. The chairman of the forum, Dr. Kaide Fahimi, also said that following the consultation with the Senate Health Committee, the Ministry of Health and the National Primary Healthcare Development Agency, all parties have agreed to lift the requirement for counterpart funding to enable qualified states access undisbursed funds to facilitate the continuous implementation of basic health care provision during the period of the pandemic. Over in Edo State, the governor says the alarming figures of positive COVID-19 cases in the state is due to non-compliance with the preventive guidelines stipulated by government. Governor Obaseki was speaking after a Security Council meeting at the government house, where he said more steps will be taken to step up awareness on the virus.
When we reviewed the COVID data, we found out that community spread is at an all-time high, getting to almost 80%. We found the cases rising, with this level of spread, as we approach electioneering, we, as a council, decided to take certain measures by increasing risk communication, trying to ensuring that we let members of the public know the risk and the risks associated with not complying with the COVID rules. We also talked about, we looked at the data on crime and the various incidents across the state for the period, where we noticed there was an increase in kidnapping cases and cases of homicide resulting from cult activities. And lastly, we looked at the security environment and noticed with concern that there's quite a bit of arms buildup in the state ahead of the September 19th elections. Security Council meeting.
Let's go over to Yobe State, where the government says that it is collaborating with some partners to construct 52 healthcare clinics to meet international health practices in the state under its Saving 1 Million Lives program. Governor May Mala Buni, represented by Commissioner of Health Dr. LAWAN GANA, revealed at a 3-day training on professional clinical skills to strengthen the capacity of 40 doctors and nurses across the state. Now, the lead person of the Training Institute, Mrs. Nkirika Okafor, also explains the willingness of the organization to provide assistance to all health institutions in the country.
We want to use this opportunity to also inform all the state members, and across the country, that those that are willing, another professional training center is ever ready to assist them in all. We met at the Commissioners Forum, and that is where we presented, and Yobe, fortunately for us, they are the first set of states, coming to have that partnership with us. And at least now that they know that it's real, the commissioner had just told you that the equipment are on ground, which we even brought in way before now, to assist them.
This particular intervention does not stop at this training. It's a multi-level, multifaceted approach towards improving the quality of healthcare services. So that also includes looking at how things are done in our facilities, and then, of course, having the experience of working abroad. They will be able to see and provide recommendations to us on how to improve on our services and how we improve on our patient care.
Following the difficulties of the pandemic and the temporary ban of motorcycles in Bauchi State, the state governor, Bala Mohammed, has launched the distribution of 1,000 units of commercial tricycles to beneficiaries in the state. At the launch of the first batch of 345 tricycles, Governor Mohammed says the project is aimed at providing source of income generation and also to minimize transportation difficulties.
The ban on Achaba was not done to make it difficult to the people, but the benefit of its absence grossly outweighs its presence on the street and the attendant criminal plans and conspiracy caused to the peaceful living people of Bauchi State. It is hoped that the provision of this alternative will be utilized for these twin purposes of providing alternative and increasing the business and economic empowerment of our people within the package of our Economic Empowerment Program, KIP. At this juncture, let me reiterate that the distribution of these 1,000 units of Keke Napep is the beginning of provision of these essential services to the good people of Bauchi State, as it is an interest-free loan to the beneficiaries who are to pay the balance in 24 months by installment payments through the Ministry of Cooperatives, Small, Medium, and Business Enterprises.
Now, for more on the Nigeria Governors Forum post-COVID-19 blueprint, we have Dr. Henry Iwunonu, Chairman, Nigeria Medical Association, NMA Advocacy Committee. He joins us from our Abuja studios. Thank you for joining us on the program.
Thank you. Good afternoon, viewers. Henry Iwunonu, to correct, Henry Iwunonu is not the chairman advocacy again, because that tenure has ended. I am now a public health advocate and a public health rights activist.
Lovely, noted. Thank you so much for joining us.
As such.
All right. Let's first get your thoughts on the national response to the coronavirus so far, just before we come into the post-COVID-19 blueprint. What do you think the response has been with the federal government and also at the state level?
Well, the response could be likened to many very practical issues in the polity. For instance, performance of our teams, either at the World Cup or at the Olympic Games or any other international competition. Because we are playing the same game, expected to score goals to advance. So, likening it here, we are expected to respond in a way to prevent or reduce transmission of the disease, to prevent more people from dying, to increase recovery rate. If you watch, most of those games, we don't advance, like Olympic Games, we don't, middle table, we're always low. World Cup, we hardly advance to the, I don't think we've ever reached the quarterfinal stage. So here too, you see, you don't put something on nothing and it will stay. How will Nigeria have responded better when the foundations are weak? It's the Holy Book that says where the foundation is weak, what can the righteous do? Even if you bring the best of hands, the members of the PTA, for instance, have shown, the chairman has shown excellence. But what can he do when the infrastructure is not there, when the funding is inadequate, when every other thing, logistic management, every other, including the most critical, which is participation of the citizens. Citizen support lacking. So we are doing as we can do. We don't, I didn't expect we would do better.
So, Dr. Iwunono, you're saying...
We are trying our best.
You're saying the fragile healthcare system is... Yes, you're saying the fragile healthcare system in Nigeria, one of the foundations, of course, is a problem. But, I mean, we were faced with a pandemic. No one expected, we didn't anticipate this. Moving forward and looking at what government is doing, the NGF and the blueprint, accessing more funds, stakeholder collaboration, what would you advise them to do?
I will refer us to a release that came from, I think, the United Nations or the WHO a few days back that said health is a choice for nations. Good health is a choice. Just like you make any other choice in life. This is the right. This is the pathway of good health. This is the pathway of diseases. If you follow this path, you are healthy. If you follow the other path, you are, you suffer diseases and die. So choose health. That's what the world is advising nations of the earth. So following from there, my advice or my take on this is that the nation should choose to live. Choose the path of good health. We have been provided with knowledge. Knowledge abounds. Health is supported on 6 structures or pillars. Service delivery is just one aspect. Most of the time we think that service delivery is all about health. Service delivery is just one of the pillars. For me, the most important is accountability, leadership and governance, the political will. For instance, the various rankings in the health sector. Nigeria is always at the bottom of everything. Just in June, we just got delisted from polio endemic, the register of polio endemic nations. So if the president of Nigeria at the very top, the governors, the legislators, everybody, including you and I, decide that moving forward, we will be healthy. We will be delisted from those countries where even diarrhea, cholera is still killing people. We'll move forward. So COVID-19 has just come again as a catalyst to help us take us to the right path. Are we learning the lessons? Are we observing what is happening? Have we made that commitment? The resolve to be better? So if we now resolve to fund health better, And the citizen will be there for accountability. The citizens should be there to say, no, this is not what we elected you to do.
Thank you so much, public health advocate. We appreciate your time. Wish we had more time to continue this issue, but we'd like to thank you so much. Dr. Henry Ewunonu, thank you for joining us on the program. We have more on the COVID-19 update when we return. Stay with us. Welcome back. The COVID-19 pandemic has seen a vast increase in urgent legislative action to control and reduce the pandemic. Well-designed laws can help build strong health systems, evaluate and approve safe and effective drugs and vaccines, and enforce actions to create healthier, safer public spaces and workplaces. To this end, the World Health Organization has launched the COVID-19 Law Lab initiative to gather and share legal documents from over 190 countries across the world to help states establish, implement strong legal frameworks to manage the pandemic. The goal is to ensure that laws protect the health and well-being of individuals and communities, and that they adhere to international human rights standards. We understand that it's the joint project of the UN Development Programme and WHO and also other institutions. Dr. Lanre Jimoh is a gastroenterologist with Carolina Digestive Health Associates. He joins us via Skype from New York. Thank you for joining us on the program.
Thank you very much for having me. I'm actually in North Carolina, so sorry for...
All right, no worries. Let's start with the figures of COVID-19 cases from the U.S. A lot of people are calling it different things, a second wave, a resurgence, but what do you call it? And is there a plan to stop the infection spread?
Thank you. I think we're still knee-deep in the first wave. I don't think we ever came out of the first wave. So I would say that's where we are. And I would say the resurgence we're seeing is mostly from the reopening and the loosening of restrictions in a lot of states around the South Belt, Southeast United States, Texas, Arizona. And so I think that's what's going on right now, is that some of these states reopened too soon, and people had what you call quarantine fatigue. And so we saw people just, doing all sorts of crazy things when they were allowed to go back out.
So in terms of perhaps the lessons government is learning and even the people, what do you think they are?
I think we're starting to see that we control our own destiny when it comes to this virus. Right now, we're thinking about getting the kids back to school, but we can't do that if the numbers are still rising on a daily basis. Another thing that we're seeing here in America is a lot of politics playing a role. Nobody ever thought, wearing a mask will become political. There's a lot of data to show that masks do reduce transmissibility of the virus. So I think the biggest lesson for us in Nigeria, and thankfully we don't have an election coming up, so our leaders can act right and do the right thing. I think it's got to be a collective effort by the leaders to set the right examples, and also by the people to try to be responsible and try to do the right thing to protect one another.
Are you optimistic with the level the vaccine, especially the Oxford vaccine, has gotten to, and perhaps some of the other vaccines so far, even though WHO is saying not until perhaps the first part of next year before we're able to access it?
Absolutely. I think that's even being overly optimistic. The quickest race to a vaccine ever in history was 4 years for the mumps vaccine in 1967. So now we're talking about trying to get a vaccine built under a year. That is being very optimistic. I think the virus is going to be here with us for some time. It's come to stay. There's a lot of positive findings from the top 3 that are now in phase 3 trials. To give you some perspective, there's about 163 vaccine candidates globally. Of those, 140 are still in preclinical stages, and 10 are in phase 1, 10 are in phase 2, and only 3 are in phase 3 as of today. Amongst them are the Oxford AstraZeneca vaccine candidate, which showed really, really impressive response. I think the key from that one is its dual action. Not only did it produce antibodies, it also produced T cells that recognize and will remember the virus in case of future attacks, because there's always questions about how long does the antibody last, and is this a vaccine where you're going to need a future booster shot 2 months, 6 months down the line. There's a lot of details we don't know in terms of getting the vaccine ready for public consumption. So I say next year, early next year, is still very optimistic. I would probably be looking at next summer, especially when you consider the logistics in after the vaccine is ready. How do you get it to the people and disseminate it globally? This is going to be a Herculean task.
All right, thank you so much, Dr. Lanre Jimo. Thank you, a gastroenterologist joining us from North Carolina. Thanks.
You're welcome. Thank you.
The UN is suggesting to governments that a temporary basic income for the world's poorest people in developing countries could help stop the spread of COVID-19. A report by the United Nations Development Programme said that the fund would allow 2.7 billion people in 132 developing countries to stay at home. It gave 3 ways in which the payout could be done: by topping up existing average incomes, awarding lump sum transfers based on differences in the median standard of living across the country, or by transferring a lump sum despite a person's location in a country. Here's more on our global update.
South Africa on Wednesday recorded 572 new deaths over the past day, the highest number of daily fatalities so far. Almost half of the overall number of deaths have been reported in the Western Cape province. It is the worst-hit country in Africa, with almost 6,000 deaths and just under 400,000 confirmed infections. Similarly, Australia has reported its highest daily number of coronavirus-related deaths in 3 months, as new infections continue to climb in its second most populous state. 5 people in Australia had died from the virus in the last 24 hours, while Victoria State said it had confirmed another 403 infections. With authorities unable to bring new daily infections below triple digits, residents in Melbourne and most of the state are now required to wear masks outside their homes. California has overtaken New York as the worst-hit U.S. state for cases of the coronavirus. The U.S. most populous state reported over 12,800 new cases on Wednesday, in its biggest single-day increase since the pandemic began. In total, it has now recorded more than 413,000 cases, surpassing New York, which was the original epicenter of the outbreak in the U.S. California also reported a record one-day rise in fatalities, along with Alabama, Nevada, and Texas. Brazil has registered a record number of new coronavirus cases, more than 67,000 over the course of the past day. The health ministry also reported almost 1,300 deaths for that period. With more than 2.2 million confirmed infections, Brazil has the second worst outbreak after the United States. The virus is now affecting smaller towns and remote areas with fewer medical facilities in Brazil's huge interior, and indigenous groups are among those increasingly affected.
That's the program. Don't forget to check our website, channelstv.com. It has the latest trends and stories. All you need to do is log on. You can access the latest on the pandemic, by the way. It has several other stories there. channelstv.com, all at your fingertips. Thank you for watching. I'm Millicent Walker. Stay safe.